Hi, so we're making a start on the health improvement and promoting well-being unit today. Now, there are a few learning outcomes here. So we have 3 learning outcomes, and we'll be looking at the first learning outcome today, which is understand the approaches to health and education. So 1.1 is evaluate the concept of health and ill health. 1.2, compare and contrast models of health. 1.3, analyze factors affecting health and well-being. 1.4, analyze the connection between diet, exercise, and health. 1.5, evaluate the role of media in influencing attitudes to health. 1.6, explain the terms health education, health protection, and disease prevention. And then 1.7, explain approaches to health promotion. So we'll be making a start on learning outcome 1. So what are the aims of this unit? So the aim of this unit is to help you to understand all of the approaches to health education and design also. So enabling you to be able to plan and implement your own health promotion initiative. So 1.1, evaluate the concept of health and ill health. So what's the definition? So with health, definition of it is just to be free from illness or injury. And illness is a disease or a period of sickness affecting your body or your mind. So we've got the World Health Organization, and this is their definition. Now, the WHO defines health as a state of complete physical, mental, and social well-being, and it's not merely the absence of disease or infirmity. So the WHO also links health to well-being, and it conceptualizes health as a human right. So it's requiring physical and social resources to achieve and maintain good health. So this is consistent with the biopsychosocial model of health. It's where you look at the physiological, psychological, and social factors in health and well-being. So you're not just looking at what you might have as an illness or a sickness. You're actually looking at your mental factors, you're looking at where you live, your social factors, your support, so it's a whole encompassing of different factors that are being looked at within the biopsychosocial model. So this actually differs from the traditional medical model. So the medical model was just looking at what your illness is and defining it, going on, giving you a treatment course, and then that's it. So with this, it defines health as the absence of illness or disease and emphasizes the role of clinical diagnosis and intervention. So on to 1.2, we're actually going to be looking at models now. So compare and contrast models of health. So we'll be looking at the biomedical model, social model of health, and the biopsychosocial model. So the biopsychosocial model of health and illness, that's quite a mouthful. Yes. So in the 1970s, an American psychiatrist called George Engel actually promoted this. So he went from a medical model to a biopsychosocial model. And it's a model that is quite commonly used now, especially when we're doing person-centered care within healthcare. So it just goes on, like I mentioned earlier, it goes on about the 3 different factors. You've got your biology, your psychology, and your social aspects. So biology with your pathology, disease, symptoms, tests, treatments. Psychology, so mental issues, mental factors like your depression, your stress, your anxiety, and then your social issues, where it could be what is your hobby. You might like rock climbing, that's why you might be getting hurt, or there might be other issues where you pulled a tendon because you do sports. Family, career, money, and any type of burdens that you may have on you. So the biopsychosocial model is an interdisciplinary model, and it looks at the interconnection between biology, psychology, and your socio-environmental factors. And it just looks at how these different factors actually play a role within your health. Then we go into the biomedical model. Now, the biomedical model actually has a lot of different names. It can be called the medical model or the biomechanical model of health. So all 3 of them are the same. So it's a scientific measure that doctors actually use to find out what the reason is behind a particular disease. So why do you get diabetes? Why are some people more prone to obesity than others, and so on. So they focus on the biological reasons solely. So this model has been evolving for a lot of years. So because of medical science now and technology now, it's been improving. So there's a lot of technology, cures and treatments that have become available, new vaccinations and immunizations as well. And then there's also an emphasis on diagnosis. So it treats it separately from your lifestyle. So it's not looking at any lifestyle factors. It's just looking at the disease itself and diagnosing in that factor. So it concentrates on the disease, the illness, or the disability, and it just tries to cure it and also return you to the physical health that you were before you were ill. Then we go into the social model of health. Now, the social model of health is actually focusing on promoting your well-being, and it wants to try and reduce social class inequalities. And it wants to make health available for all social classes, regardless of whether you can afford treatment or not. I mean, we don't have that issue within the UK anyway. We're all in the NHS. You get treatment regardless as it is. But in other countries, it would make a difference. So make sure that you get access to health information, hospitals, clinics, health websites, community centres, and it tries to help you to lead a better health choice and lifestyle. Then we've got a bit of a contrast between the social model of health and the biomedical model of health. So the social model of health, it analyzes the social aspects of health. It helps you to learn about social phenomenon impacts on the patient. So it looks at factors like lifestyle, environment, and economy. And then the biomedical model, it helps the professionals to treat the disease. It focuses on biological reasons only, and it attempts to cure or return you to your pre-illness state. So that was 1.2, and now we're going to go on to 1.3, which is analyze factors affecting health and well-being. So there's a lot of factors that can actually affect your health. So, it's your social, your economical, your biological reasons. So, how you grow, how you live, how you work. Now, these can be called social determinants. Now, since the mid-1980s, there's an understanding that the determinants of health are actually critical to your health and well-being, and also about how the population is growing. So these determinants are now, they're quite universally accepted by health systems across the world. So we've got a few here. So health and status well-being. So you've got your social environment, economic environment, your health services, your physical environment, your health behaviors, and your biological influences. So the factors that can actually affect your health and well-being are your lifestyle, exercise, substance abuse, drinking, health practices, social class, age, culture, gender, sexuality, financial stability, employment status, housing, pollution, workplace health, and physical factors. So as you can see, there's an insurmountable amount of factors that can affect your health and your well-being. So let's make our way onto 1.4, which is analyze the connection between diet and exercise. Now, we know that staying healthy is a priority for a lot of people. Now, I won't say that it's every single person's priority to be healthy, but it's quite high up on the list for a lot of people. And really with this, it really depends on what your daily choices are to determine how healthy you want to be. So not everything is in our control. You might think you want to be healthy in one aspect and say, right, I'm going to start exercising, I'm going to change my diet, I'm going to be taking walks around the park every single day. But then habits can actually approach and take over your health as well. So there can be a difference between being healthy and unhealthy, and habits would be an issue. So both diet and exercise, especially exercise, can have major effects on your mood. Now, it actually releases endorphins, and these will actually make you feel happy and positive. And it's a lot of exercises will actually release these, and even though you feel tired after your exercise, you feel good. You feel like you've achieved something. So when it comes to diet and exercise, they work together to promote your health. So the exercise will stimulate your muscles, and it promotes your muscles to promotes muscle protein synthesis. And eating protein immediately after your workout, if you've done aerobic or strength training, will help you to repair and replenish your muscles and promote muscle growth. And again, eating a well-balanced diet can help you to get the calories and nutrients you need to fuel your activities. So especially when you're doing regular exercise as well. So making our way onto 1.5, evaluate the role of media in influencing attitudes to health. So when we look at media, there can be a big influence about how you will work towards your health. So things like from television, radio, film, games, advertising, social media, Facebook, Twitter, Instagram, all of these will actually have a big impact on an individual and the population's health overall. So exposure to media, especially for little ones, it can have different types of health behaviors. Now, it can either go in a positive way or in a negative way. Now, when we had, throughout lockdown, we had Joe Wick's PE classes, and that was a positive role model there, showing that, right, you're stuck at home, you can't be going to school for the little ones, even for the adults. Do this exercise 20 minutes a day and it'll help you. And it was giving a nice image to the kids, saying that, yeah, we can do this, we can be healthy. But then again, you have other effects as well, where you might have these adverts for what are they called, Uber Eats, and all of those saying, oh, we'll deliver to your house, McDonald's, KFC, and all that, especially with the big adverts you see for chocolate, sweets, and everything. And they can have an effect on you as well. So these type of exposure can lead to substance abuse, sexual activity, and again, your eating habits. So we get positive and negative influences. Like I mentioned about Joe Wicks just now. He had those live lessons. He achieved about 950,000 viewers for his second live stream, which is amazing. So all within the second showing. So it showed that how many people were actually following him at that time. And then you got the negative influence, like the fast food that I mentioned, where you got KFC, McDonald's, all these fat-laden foods, and saying that common eaters were really good. They're inexpensive. It won't cost too much, but they're terrible, in my opinion. And then you got the impact on yourself. So again, media can have a positive or negative impact on you. So a positive impact might be if you've decided you want to lose weight, but you found that you can't, have that motivation on your own. You might want to join a group where you're with like-minded people who are trying to lose weight, and you could, encourage each other, speak to each other, send messages to each other, share pictures of your progress, and you'll be encouraged. You can read success stories and look at other people and how they struggle with their journey, and it's a positive contribution for you, because you're saying, yeah, that person struggled, but look what they've achieved, I can do it too. Then you can have negative impacts on yourself as well, and this is where you might have certain body types that are portrayed and say, oh, this is what is perceived as attractive, or you have to have a certain size waist to be looked at as if you have got any worth. And then there's other shapes that are put down in movies and things. So somebody who might be a little bit bigger, you might have movies that portray bullying and being left out and all of those. So you can have negative impacts as well. So that was 1.5, where we looked at the role of the media. And now we look at 1.6, which is explain the terms health education, health protection, and disease prevention. So health education, what is it? So health education is a profession of educating people about health. So there's areas within this profession that encompass environmental health, physical health, social health, emotional health, intellectual health, and spiritual health. And they also look at sexual and reproductive health education also. Then you've got health protection. So health protection is a term that encompasses a set of activities. So this is defined as protecting individuals, groups, and populations from single cases of infection diseases, incidents and outbreaks, and non-infectious environmental hazards like chemicals and radiation. And then it's also put into terms where you need to contact the health protection team if any of these issues arise. Then the final one in here is disease prevention. Now, disease prevention is the deferral or elimination of a specific illness or a condition. So this term is actually applied to human health, but the principles will actually apply to animals and plants also. And then the final learning outcome, assessment criteria, I apologize. So the final assessment criteria is explain approaches to health promotion. So there's a lot of different approaches to health promotion here. So you've got the medical model, you've got the behaviorist approach, the educationalist approach, and the empowerment, and also even fear. So we're actually going to be looking at medical model, behaviorist approach, and the educationalist approach. So the medical model. So this actually focuses on what activities are put into place to reduce morbidity and premature mortality. So it's targeted towards populations or people that are in high-risk groups. And it's that type of health promotion that seeks to, it helps you to increase medical interventions, and it wants to be there in place so they can prevent ill health and premature death. So it has 3 levels of intervention. So you've got primary prevention, where the prevention of the disease is through education. So, and also immunization and encouraging things like non-smoking, don't eat too much sugar, and so on. The secondary phase is prevention. Secondary prevention is to prevent the progression of disease, so screening, and any of those are the types. And then the third is tertiary prevention. So it's to reduce further disability and suffering from those people that might already have gotten ill. So also to prevent the recurrence of these illnesses. So things like rehabilitation, patient education, and palliative care. And then we come on to the behaviorist approach. Now, this approach, it just aims to encourage individuals to adopt a healthy behavior. So within the behaviorist approach, this is seen as a key factor. So it's there to help you to make health-related decisions, and it can be quite a complex process if the person's not ready to take action. And it's not going to be effective if they're just not in the mindset to take action at that time. So you have to be at a mindset where your service user or your client is ready to actually listen. That's the only way it will work. So it is there to help, to more or less to influence or change health behavior and to give health education. So this approach has got a bedrock of activity, and it's been undertaken by a lot of agencies for health promotion. There's campaigns that have been put out to stop people from smoking, to adopt a healthy diet, to take regular exercise. Is targeted towards individuals, but also is put through as mass communication. And then you've got the educational approach. So the purpose of this approach is just to provide knowledge information and to give people the necessary skills so that they can actually make an informed choice about their own health behavior. So the educational approach is different from the behavioral approach. So it doesn't set it out, like the behavioral approach is there. It's trying to persuade people to do a certain thing, to lose weight, to stop smoking, to look after themselves if they have diabetes or asthma, and so on. So it's there to persuade and motivate. But the educational approach is just there to inform, to give people the knowledge so that they can make their own informed choices. So educational approach is intended to have an outcome. So like everyone, they all want outcomes. They want this outcome to be a voluntary choice for the person that they're talking to, the client, the service user. So, they've got all the information and they've made a choice and they've decided to do A, B, or C, whatever suits them. Now, psychological theories actually state that learning involves 3 aspects. So you've got cognitive, which is gaining information and understanding it. Affective, so having an attitude and having the feelings that will work towards what you're understanding. And then the behavioral, which is the skills. So an educational approach to health promotion, it just helps to provide information and it helps them to make an informed choice. And this can be done through a lot of different ways, like leaflets, booklets, advertisements, little posts on Facebook or Instagram or Twitter, through displays or even one-to-one advice. So today, what we've looked at is the concept of health and ill health. Then we looked at a few models of health. We looked at factors affecting health and well-being, the connection between diet, exercise, and health, the role of media in influencing attitudes to health, health education, health protection, and disease prevention. We looked at what these actually mean, and then we looked at the different approaches to health promotion.